Good morning. I'd like to start today off by first introducing topics that all of us can share in the accolades of the wonderful team of people here we have at Neomed. So I'd like to start by recognizing some of our faculty and staff who've received funding from federal agencies to recognize the great work that they do and to help them carry on that work so that we can all benefit from it. First, I'd like to recognize Dr. Mary Rosen. Dr. Rosen received an outstanding award from the NIH, and I received notification of that within the last 2 weeks. Also within the last 2 weeks, Ms. Margie Sanders received a HRSA grant award from the federal government, and Dr. Fayez Safadi received a National Science Foundation I-Corps grant. So thank you for all the great work, and please join me in recognizing these outstanding faculty members for this great recognition of what they're doing. Additionally, during our last address, I noted that Dr. Bao had received an SBIR for commercialization efforts on his work that he had completed here at Neomed. And over the last few days, he was recognized by Cranes in a very well-written article, and I encourage all of you to go take a look at that article, recognizing the work he's doing in tinnitus, as well as the SBIR award that he had received. We've got an amazing group of researchers here at the university, and we all should be sharing in these accolades, as the work they're doing is really possible because of the great work the university is doing to support them. But this is a recognition of their individual efforts. I also received a letter from one of our recent graduates, Dr. Robert Becker, a graduate from 2020, so a newly minted physician out in the community starting his residency, wrote to share just how highly he thought of Dr. Paul Lacaw, Dr. David Sperling, and Dr. Joe Zarconi. To paraphrase, he said, "They provided an incredible educational experience for me," and he praised them for their mentorship and as serving as ideal professional role models for all students to be able to look up to. So thank you, all three of you, for the amazing efforts that you put in for Neomed students. And this is just one small way of recognizing what you do. I'd also like to take a moment to talk about some of the difficult decisions we've had to make regarding budgetary constraints due to the pandemic and the pandemic's effect on the Ohio economy. As all of you know, we've taken and are predicted to take substantial losses at the university, both associated with operating losses, so running our organization, and the other regarding state subsidies that we're given to support the important mission of Neomed for the state of Ohio. One of those cuts that was really critical to get us where we needed to be was a reduction in the tuition assistance program. And while I do understand that even the limited cuts that we made still have some pretty substantial effects on those who may be in some of the lower pay tiers, what we've done for this year is worked with our foundation to be able to set up an account that will provide some scholarship dollars to our staff. This is going to be need-based, and it's going to be based on those who have the highest need relative to the income that they generate here at Neomed. While this may not completely cover the additional losses that they will take due to changes in our tuition policy, this will help. And so you should see an announcement soon. Right now, Daniel Blaine from our advancement office is working with Mr. Andre Burton from our HR office to be able to put together a descriptor and an application process. And our goal is to try and lessen the burden as much as possible. So this is just one way we were able to use foundation dollars to be able to assist our staff. And I expect this will mostly be our staff who are the ones who are most impacted by this. On Tuesday, we have a visit from the Liaison Committee for Medical Education Secretariat. The Secretariat is a group of experts who've been appointed to assist us with our response to the LCME concerns. We will spend all day with them on Tuesday and have a sign-out briefing from them. What they'll be doing is looking at our action plans, the ways that we're going to address some deficiencies that the LCME recognized we needed to make improvements on. I expect that that's going to go very well, and I would once again like to thank the entire team of individuals who've worked on our plan for getting through LCME with flying colors this next time around. And I feel pretty confident, so we'll give you further feedback as we learn more. Our strategic planning process is still well underway. We expect a fully baked, ready to go strategic plan for your viewing and for the Board of Trustees viewing by September 9th. The assistance you gave us by answering the surveys in the 7 areas that are critical for plan development are driving the decisions that we're making. We're listening to you. That was the intent, not to have you fill out a survey simply so that you could feel like you were part of the process. We had you do that so that you are part of the process. We just had a meeting of the leaders, over 20 individuals from the university representing a significant footprint across all the colleges, as well as all of our major non-academic divisions, in order to ensure that we are doing this correctly, that we are setting our way forward for this university and substantially taking into account what your thoughts are and where you think we should be going. As a quick highlight, I'll note that most of you felt our current mission statement and our current vision statement were inadequate, that they were too regionalized. They didn't really share what it is we do and where we should be going. And at the same time, you provided many ideas through which we can start to shape a new mission and vision statement. And we are currently working on that, and I look forward to being able to share that with you in the future. I also want to thank all of you for your response to the HR survey and then the HR query as to who would be interested in performing in our trial enrollment in the variable work hours plan. There was a large number of our staff who've asked to participate. So we will be getting this underway and working with you and following the impact that it's had at the university. And if this works to the university's advantage and your advantage, or is break even, meaning we're able to do what we do now without the restricted work hours that we currently have, then we will certainly put this into place as the way we do business going forward and in the future. Whatever we can do to make things easier for our employees so that they can continue to deliver on Neomed's mission, we're certainly going to do, and we're going to promote, because it just makes sense for us to do that. We're making substantial changes as follow-on from our diversity discussions, where many of you came onto a very in-depth discussion of diversity and racism, systemic racism and its impact specifically in education and the healthcare sector, and here at Neomed, and how people felt and what the experiences were. We are continuing to move that discussion forward. I am putting together a Neomed Presidential Diversity and Equity Advisory Council that will be made up of leaders from across the community within the state of Ohio and without, who are mostly Neomed graduates, but also some leaders in the community locally. We'll have an announcement as to the makeup of that organization in the near future, but I'm extremely thrilled to say that the person who will be chairing that committee has been chosen already, and we will make an announcement on that in the Pulse very soon. This is a great time at Neomed as we are having our students back on campus. Despite all of the challenges and the adversity that we've experienced over the last 3 to 4 months, we've made this campus a safe place to be. That was our #1 goal. And our students are already back on campus getting ready for the beginning of a new semester. I had the opportunity to meet several students, including one student, Savannah, a new M1, ready to start the new medical school curriculum in 1 week, as well as her family who came up from Florida. We're excited to have them here, as well as the rest of the students who are starting to populate back on campus. There's a new student orientation for the College of Medicine beginning this week, with the culmination of this orientation week ending with the white coat ceremony on Friday afternoon. While it will be a virtual ceremony, it will still recognize the important milestone of entering medical school and getting ready for their journey, which will end with them independently caring for patients across Ohio and across the United States. We'll have our College of Pharmacy students back in the August timeframe, approximately August 3rd. And our College of Graduate Studies students are already here, many of them through our research fellowship program. So you'll see the campus is starting to see a lot more activity and a lot more bustle. There are more cars parked in the parking lot as phase 3 is nearing its end of our return to work and return to campus plan. We've been incredibly successful through all of the efforts of our operations team and those who've assisted them, as well as our pandemic medicine leadership team led by Dr. Zarconi, who are here to ensure that our campus is safe. We have blocked off every room with the maximum number of participants allowed. We've implemented mandatory face coverings, 6-foot social distancing, screening, return to work, isolation and testing requirements, and we have hand hygiene stations located and filled throughout the university. And during phase 1, phase 2, and phase 3, I'm not aware at this point of a single COVID-19 case that has been spread on this campus. I feel we've done an incredible job, and I really applaud the efforts of the team who's led this for us. We are ready to start the new College of Medicine curriculum in 1 week. Monday of next week, we will see this brand new curriculum kick off. And I'm sure there's a lot of nervous people who've put this plan together, but they've done an incredible job. And almost certainly we'll see little issues that we're going to have to deal with, as you do with everything new. That's been a major opportunity for us to do things differently, unfold for the first time in real time, become operational. But I'm absolutely confident it will be an incredible new addition to this university, and we will have found a better way to educate our students, which is ultimately our goal. The economic crisis has been very real, and I wanted to spend a little bit of time talking about this because I know many of you are nervous or anxious during this time where we rely on continuing to work and continuing to have benefits and a paycheck. It's part of ensuring that you have good quality of life. What many of you have witnessed in the last week is that University of Akron, like many other universities in this state, are already responding to the very difficult economic conditions that exist. There was an article that came out this last week in Higher Education Times, which is one of the journals that universities use to share information with each other. And the article was entitled, Budget Bloodbath at University of Akron. And though that title was really meant to capture the attention of the reader, it really was somewhat appropriate. Due to the economic downturn and pre-existing conditions, University of Akron noted that they were downsizing substantially more than had been previously discussed, and they've implemented large layoffs. This last week, they announced they are eliminating 97 full-time faculty positions. It's about 18% of their faculty workforce. They've eliminated an additional 60 staff positions, 21 contract professional positions. And in addition to that, another 84 have agreed to either resign or retire, resulting in 262 lost positions since the beginning of the COVID-19 economic downturn. They expect a total salary and benefit savings of about $16.7 million, but that won't be enough. They've also had their departments reduce their total budgetary spends by up to 25%. They've restructured from 11 colleges to only 5, and they've cut $4.4 million from athletics and eliminated 3 sports from their athletic portfolio. Our hearts are with Akron. The University of Akron is a partner, and we are here to support them in any way we can. But this is an example of what most universities across the state are experiencing, and many do not know whether they will survive this year. It is anticipated that universities across the United States will end up shutting down because of COVID-19. And at Neomed, we are not immune to this. I do thank every one of you for helping us with making very difficult decisions and budget cuts so that we could continue to survive. But these cuts got us through the known reductions that we're going to experience. We all need to keep in mind that if we were to have another surge and no longer be allowed to be on campus through state order, for instance, this coming semester, if that were to happen, we would almost certainly be required to go back and reassess our budget and may have to make many of the very difficult decisions that University of Akron has had to make. It's critically important that we do everything we can on this campus to ensure that this campus stays safe so that that doesn't happen. That means we need to follow all of the policies and rules that have been put in place. So when you're here, if you see somebody with a mask off, don't yell at them, just remind them. We all can be forgetful. Just as we have laws in place and fines in place to prevent speeding for your safety, we know that sometimes people forget. And what they do is they get a reminder, and that reminder is usually in the form of lights behind their car and potentially a penalty that they're going to pay. What we would like you to do is to also serve as our police, not in a legal sense, but to police each other, to remind each other, put the mask on, remind each other you're a little too close, please keep 6 feet of distance, remind each other to use the stations for hand hygiene. We are a safe campus. I'm absolutely convinced of that, and I've been on campus every day. During the work week, I am here trying to show others this is a safe place, trying to set the example. We cannot expect our students to be here and feel safe when we tell them this is a safe place to be, if we also don't lead and show that we are here and that we feel this is a safe place to be. If at some point we feel this place is not safe for our faculty, our staff, and our students to be here, we will implement changes immediately. When we're making these decisions, we always have 4 things in mind. First and foremost are, what do the state laws tell us? And right now, the governor's put in changes to his plan that occurred when the pandemic first evolved. And now there's an allowance for people to come back to work, but to follow safety guidelines. In fact, the state feels safe enough now that they are allowing properly structured weddings to take place. They are allowing congregation in some areas to take place, but they're being smart about this. So now they're monitoring counties and determining which counties need to change their rules, which counties need to mandate face coverings, depending on the risk that you may experience in that county. And fortunately, we are in a low-risk county relative to some others in the state. The other things we look at is, how do we deliver an education that's going to create talented and competent healthcare providers and researchers? You really can't properly educate a medical student, a pharmacy student, or a lab researcher without giving them that hands-on lab component necessary to be competent with their skills to eventually take care of all of us or to solve the biggest problems in healthcare. They need to be in the lab space. So this is the reason we've chosen a hybrid model. We're reducing our footprint substantially, not having students close together, not filling several hundred in a classroom, and being very judicious about how we do this. The third thing that we think about, which really is a higher priority than the educational piece, is safety on this campus. We need to make sure that no matter what, this is as safe as we can potentially make it. And I feel this is far safer than what we do on a weekly basis, which is going to a grocery store, going to a pharmacy, going into a Target or a Walmart, going to the gas station, handling the gas pumps. There's risk in everything we do, but we need to mitigate that risk as low as possible. And even sitting at home, we are not completely safe. We receive mail, we receive packages, and all of those pieces of mail and all of those packages have been contacted by numerous people along the lines before they show up on our doorsteps. We can never be completely in isolation. What we need to do, and what we have done here, is to ensure that every possible policy has been put into place. Every engineering plan has been put into place that we could come up with effectively and efficiently to maintain the safety of this campus. And then of course, number 4, although should be equal on the list, the other 3 must come first. Number 4 is to ensure that we keep our employees safe financially, that they have a paycheck, that they have benefits to help them live their lives. And that's the balance that we make when we decide what it is we're going to do relative to who's going to be on campus. Phase 1, 2, and 3 have gone very, very well. We are going to be entering phase 4, which is a complete return to campus on August 3rd. The only exceptions to that are going to be those who fall into the federal guidelines under COVID-19 and Fmla. And those individuals will need to go through HR. This has been brought up by our HR team, as well as many of the leaders across the campus, that they've had employees, staff, and faculty call in working one-offs with their departments. But we need to have a uniform policy, and that uniformity will come through our human resources team. Most have expressed their strong commitment to coming back to the campus safely. But there have been a few who've written their supervisors across different areas of the university concerned, and we understand that concern. However, we also face an issue of fairness and equity. We have many people on this campus who are here day in and day out, in fact, have been since COVID-19 started. Our operations team, our police force, many of the leaders from across this university have been here. And now we have our technicians and staff personnel in the laboratories. We have our College of Medicine curriculum team, many of them, as well as those who are here for student services. We have a coffee shop that is open. And next week or this week, I believe, we're opening up our bookstore. So all of us need to be comfortable coming into work. And if you do fall into the federal guidelines, we will abide by those, but it's going to be done as a uniform process through HR so that this doesn't come down to a concern of why one department or one section did this one way and another did it another way. We need to ensure fairness and equity for all of our employees and all of our students. I also want to note that all of you should have received a campus safety letter from Dr. Zarconi. That notes that we have city training that's mandatory for all of us to do, and that needs to be done as soon as possible. The city training is simply training for all of us to better understand what we can do to ensure we have a safe campus. how do we follow the guidelines? How do we really implement this? So please get online and get that training done as soon as possible, but certainly no later than August 3rd for those of you returning at that later date. But for the rest of you, please get it done this week. It's really critically important, and that just came out, and I will be getting mine done today. We have COVID testing on our campus for all of you, your friends, your family, anybody who wishes to come onto campus to get COVID testing. It's going to be here on July 21st, 23rd, and 25th, and it is going to be absolutely free. We are doing this in partnership with the Department of Health here in Portage County, as well as the Ohio National Guard. So as you drive onto campus, you will see 3 large drive-through tents juxtaposed to each other. We will have a process starting tomorrow where you can drive onto campus, stay in your automobile, fill out your paperwork, and then you can get tested by the professionals from the Ohio National Guard. They will send those specimens off, and you will be informed of what the results of your tests are. You do not need to be symptomatic. In fact, we would prefer not to have highly symptomatic patients here on campus. That should ideally be done through their healthcare providers and limited contact. Though all are welcome, this is for everybody, including those of you who are asymptomatic and just want to know. We are hoping to be able to continue this partnership with the Ohio National Guard and ideally be able to offer free testing in our campus over the next few months, at least 3, if not more days during that month period of time. The other thing that we're implementing at Neomed is a COVID clinical care team. We have already secured the services of 2 physicians. We're still working the contract details out for them, but this is going to ensure that we have physicians on our campus to be able to provide guidance on COVID-19 restrictions and policies to ensure they're being properly followed. And we are working to set up a clinical testing program where, unlike the Ohio National Guard program, you'll be able to come in and use your healthcare insurance to be able to have a test sent out. And we are working right now with Summa Healthcare to be able to use their clinical testing labs to be able to do that. These same physicians will make recommendations on whether you should come to campus or not, whether or not you need to quarantine or to isolate, and when you will be allowed to return to campus if you've been directed to quarantine or to isolate. We hope to have it completely stood up by the 2nd week of August. We are moving very quickly to get this in place and to have a program here at Neomed that will really help ensure your safety during this time. But as I've noted, I feel this is a safe place to be. We've done everything within our abilities to ensure that it is. And you'll note now that there are quite a few of us back on campus and feeling pretty comfortable being here. So with that, I'm going to stop and open it up to questions.
First question, with all the universities around Ohio having layoffs and more financial burden, are you still confident that Neomed will not have to lay off any employees, especially with benefit changes that were put in place and the increase in parking fees?
So we are not going to be in a position where Neomed does not lay off any employees. We may have a very small number. In fact, we expect that there's going to be a very small number who will be laid off. In fact, we're expecting it to be less than 12. But otherwise, yes, we really don't expect that we're going to have to make any substantial, really large-scale layoffs or furloughs, at least at this time. But as I noted, if we end up with a surge that takes place again, and we are directed by the state to shut down, or we need to shut down without state direction because of safety and wellness issues, then we could be in a position where we're going to have to do that. So I can't give you 100% confidence. I can just say that given what we know now, how we're doing on this campus, with no second surge, I feel comfortable that we're in a good position not to have to do that.
Considering the surge in cases in Ohio, are we considering any rollbacks of our return to campus plans for August? If no, what is the rationale for having staff faculty return to campus who do not need to be on site to do their jobs, considering the risk for those who live in Portage, Summit, and Cuyahoga and other counties?
So for now, we're going to follow state law. And the rationale for that is that we have students coming onto this campus. We feel that we need to have in-person education in order to adequately train our healthcare students and our research students. And we've created a safe campus for them to be on. And we need to lead and show them we have a safe campus for them to be on. The other issue we have is an issue of fairness and equity. While some people may be able to continue in the long term to effectively work from home, periodically, our intent is that nobody works completely from home, because you need to be able to periodically at least be on this campus to understand who we are, the mission of this organization, and interact with the others on this campus in order to be truly effective at what you do. Does that mean eventually for some people 1 day a week, 2 days a week? Potentially, but we don't know yet. We've not really studied this adequately, and we've not really had an opportunity to study where we've had reduced performance or potentially increased performance because of COVID-19 with the virtual work that we've had in place. We just don't know. And what I'm hearing from many of our employees is, why do I have to come in and why do I have to be here if they don't? And I get that. What we've done instead is said, we've created a safe campus for everybody to be on. We've created a safe campus for our students to be on. And we need to be here with our students, showing them that this is a safe place to be. If at any time we feel it's not, if at any time we don't feel this place is at least as safe as what you're doing now, then we would eliminate that. But we're here as a university to serve our students. Education is a key part of our mission. In fact, per the state, this is the reason we exist. They funded us to educate future healthcare leaders and researchers for Northeast Ohio. So we need to be able to show our students we are here on a safe campus that we're asking you to be on. If we don't, if we find that we can't do that, that's when we have to shut down and go virtual. And that's when we're going to have to sit down and make intelligent decisions about how we lay off and how we furlough.
Are masks required when outdoors on campus property?
So again, we're following state guidelines, and we are in a county right now that does not require that. What we're asking is if you can't be more than 6 feet apart outdoors, that you must wear a mask. Some counties are going to masks outdoors if they are in high risk areas. We are not right now. And so we will continue to adapt as we watch the situation evolve. And if we get to the point where we're going to be mandated to do that, we will. In general, the experts, the CDC, the state leadership, they feel that when you are outdoors, that the risk is low enough if you are more than 6 feet apart that it is not necessary to wear face coverings. And so we're going to continue to follow national and state guidelines on this.
On August 3rd, for employees that share offices, will they be required to share an office during the workday?
That is going to be a decision that gets made by the area supervisors. If they can separate people out, then the answer is they won't need to, as long as the individuals are isolated in offices. When we're in common work areas, the answer is we will wear masks at all time. We will likely increase breaks so that people can go outside and take the masks off for breathers. What we're seeing right now is that people who are on this campus in many areas, regardless of whether they're in an office or not, many of them are just choosing to wear their masks. They find them adaptable. They find them comfortable enough to do this. As a surgeon, I can tell you that I go 8 to 12 hours during a day with my mask on, only taking it off to leave the operating room and go back in. It's something we get used to, and it's something we have to get used to for safety. But if at all possible, we will find ways to separate people out in shared offices. We may We may have those individuals shift periodically so that someone can go into an office alone and be able to demask if that's something they need to do for comfort. It's a decision we'll make once people are back on campus and we can better start to understand how this can be implemented.
Would there be an antibody test? Also, what would be the cost for the test?
So right now we do not have antibody tests that are broadly available to the community. And we don't really know what those antibody tests mean. So as individuals, you can go to a physician and ask to have them ordered if you think they're indicated. And they will work with you to decide whether they believe they're warranted, and then they will share costs, which are highly variable depending on the test that you get. At this time, it's not recommended that they be broadly performed. So we will not have those on campus. We have viral testing being done on campus currently by the National Guard, and we're working with SUMA to be able to do viral testing for those who are symptomatic. That's the testing we're going to do individually with physicians will be for symptomatic patients who we have a concern about. The free testing being done is for those individuals who just wish to know. Just remember, when you have that test done, you may find that you're negative, but that may not reflect your status in 2 or 3 or 4 days. The decision was made by the governor of Ohio to do this testing. And the real intent of this test is to better understand what percentage of the population is currently carrying this who may be asymptomatic. And we don't know what our asymptomatic carrier rate is.
What is the turnaround time for COVID test results if we take the test this week on campus?
So that's a good question. We had been getting 24 to 48 hour turnarounds on these tests. Many places are indicating they're now taking a week. I did speak with the director of SUMA's laboratory, who noted if they do it in-house, it'll be 48 to 72 hours. If they become overwhelmed, then they send it off to a large laboratory called ARUP. And they said it can take up to 5 to 7 days, though they were very surprised that when they've been doing that, their turnaround time has still been closer to 72 hours. As the demand and the testing centers do more and more tests, that time is obviously going to get a little bit longer. Anything else, Michael?
Yes. Is Neomed's leadership considering economics as the primary factor for returning to campus?
No, the primary factors that we're looking at are the ones that I laid out. First and foremost, what is the state telling us? What are the state laws? Because they're taking our safety into account. That's the job of the Department of Health. And right now the Department of Health says we're safe to be here. Second, it's what do we need to do to ensure we have a safe campus? And we've done that. Third, it comes down to what do we need to do to ensure we are adequately educating the future doctors, pharmacists, and researchers who are going to be graduating from this institution to ensure they're competent and qualified to take care of patients or to conduct research, which requires some presence on our campus. And then fourth is economics. That's ensuring that there's a paycheck for you. Because I could easily move to virtual. If we do that, then many of us are going to find that we don't have the ability to not lay off. We don't have the ability to not implement furloughs. That's a fourth consideration, and that's lower on the tier because we have to ensure the safety of this organization first, and that we are properly educating students to be qualified professionals. Otherwise, we're not fulfilling our mission. And if we're not doing that, there's really no need for any of us to be here.
Can you explain what you mean by the term you use, one-offs? And when you say those that are not returning past phase 4 or going through HR, do you mean they are not actually continuing to work off-site, but are exercising their right to FMLA and not working and not getting paid?
Yeah, so when I say one-offs, that's been what's taking place at this point, and that's something we need to change. In fact, that's frequently done here for many issues that should be centralized. So for instance, If an employee calls in and says, I don't really want to come in and work just because I'm anxious, not because I can prove that I've got a high risk category individual living in my home, or that I am myself a high risk individual, or per law right now that I need childcare. And it's not that you just need childcare, but that no childcare is currently available to me. That meets the federal guidelines. And the federal guidelines would say, well, under at least until December 31st, these individuals can practice the requirements of FMLA, which allows you to burn through your banked leave and sick leave. HR will have to set the guidelines as to what we do after that, depending on a number of different factors, because FMLA doesn't guarantee a paycheck, it just guarantees that your job will still be here when you come back to work. The one-offs are when individuals call their supervisors and call and say, I'm anxious, don't really want to be here, I feel like I don't need to be, I don't want to come in. And yet another person calls their supervisor and says the same thing. And one says, well, that's okay, you don't have to be here. And the other says, nope, you're going to be here, get into work. And those one-offs create fairness and equity issues. And the fact is, we would not be asking you to return to work if we didn't feel we had a safe campus. And we do have a safe campus. That's why I'm here. That's why I've been here every day. We have a safe campus to be on. We feel comfortable that you are here and you are safe. We know that as this drags out, we're going to get more and more individuals who feel they just want to perform their work from home, even if it's not being done as effectively, because it's easier. You pay less money to drive your car. You don't have the maintenance issues with your automobile. You may not have to have doggy daycare or child daycare. And this is something that all of us do. It's part of our lives. But those types of things increase your spend. And so more and more individuals are going to want to not be here on campus, but we can't do that if it's going to impact our ability to educate our students, because that's first and foremost. And we can't do that if it's going to mean we're not performing research at a high level. And many would say, but that might not be an issue. My laboratory technicians are in there, my staff are in there, why do I need to be there? I can absolutely assure you, your research is not as productive when you have a team of individuals who are there and their leadership is not there. The backstory that occurs is, why is it safe enough for me and not for them? When in fact, we feel it's safe for all of us. We need to be able to step up and show that. And if it's not, we will shut this campus down.
Since we determined that the campus is safe, and for those individuals who have kids and do not have access to daycare, or they don't want to participate in FMLA, can they bring their kids to work?
No, we're not allowing kids coming to work here on this campus right now. We don't have the ability to be able to do that effectively. That is something I'm happy to have a discussion with our general counsel on, but I think that would not set up a good work environment here. Many of us, including myself, have to make these difficult choices. I have a just turned 10-year-old and a 12-year-old at home right now alone. I had to make the decision as to what we were going to do, and that decision was that we felt they were safe. We make phone calls periodically to check on them. When we made the decision to have children, we knew that we were going to have this extra burden that goes along with the extra joy that comes along with having children. We've had to pay people to watch our children throughout periods of time before they got into school and over the summer. So we understand this is a burden that employees have, but the real issue is it available to you? If it is not available to you because of COVID-19, that's when the federal government says that we have to be sure that we account for that and then take care of the employees.
Has Ohio finalized its budget and know what the % of reduction is at this point?
So as I shared in our last update, what they've told us is to expect a 20%. And what they then came out and said is for right now, and they give it to us in monthly increments. What they've said is for right now, we're going to give you, it's about a 4.8% across the board to the university's reduction. However, in big letters was, there's a warning label with this, is the term that was used by the chancellor's office. And that is, that's just for right now. We very much expect there could be a second surge. And if there is, and we shut down, 20% or more will be your cuts for this year. So what they do is in the first couple of months, they're going to give us on average, the university will get 4.8% less. But then say November rolls around and we take a big cut because of surges, then the next cuts won't be 20%. They'll be greater than 20% because they're going to account for the fact that they didn't hit us with 20% in the first few months. So we may up to 25, 26, 27%. So essentially they've just said, for now, we really don't know. So we're going to give you 4.8% cuts, but it could be more and it may very well be more. So we don't know.
In reference to the city training, it requires you to specify which type of researcher you are. For those who are not researchers, what should we put?
I have to confess that's getting into the weeds that I don't know the answer to. So I'm going to ask Dr. Zarconi and Dr. Schmidt to send email guidance out on that. We have a separate one for students to be able to do that certainly shouldn't ask that question. This was just rolled out today, so this may be one of those nuances that we're going to have to correct. So I'm going to ask that team to do that and ensure that we get that solution to you today.
Can you please specify when the layoffs will occur?
Well, first of all,
it's going to be announced.
So that announcement will come out later this week. And it's essentially going to affect personnel that can't be here and work on this campus because there's no ability to be able to do that level of work from home.
When will the pharmacy students get their final schedule, and can you expand on the meaning of hybrid?
I don't know when the pharmacy students will get their schedule. Dr. Kasmer and his team should be sending that out. And I know some of them are on this call now, so I'm going to ask them to do that because we are just a couple of weeks away from the students starting here on campus. And hybrid model means we are not going to have every class completely in person on this campus. We are going to do mostly small group sessions. We are going to do laboratories on this campus. There will be some classes that are going to be allowed to be taught in a format where the individuals may be at home on their computers like we had to do in April. It also means, depending on the college and how they want to implement it, that they may have a reduced class size. They may note that, for instance, one room under safe distancing conditions can hold 80, that we're going to have a group come in and of 80 and do, for instance, college of medicine is about 162. So if 80, 81 came in, then perhaps they would set it up so that the other 81 would be at home and then they can flop back in so that there's some in-person instruction. I did not get into the weeds with our team on that, just that we were moving forward with hybrid instruction because we have no rooms that will hold 162 medical students under the 6-foot distancing rules on this campus. So we simply cannot hold classes that way.
If staff or employees that participate in the free testing and are marked positive, how will this be addressed?
If those individuals are marked positive, they're going to have to follow the state guidelines, which is a 2-week mandatory isolation, not quarantine, but isolation. So the difference is quarantine is the term that we use for people that we don't know if they're sick or not. This is what was happening in the past where the state would say, if you traveled to Florida and you came back, quarantine yourself. Chances are you didn't get COVID-19, but we don't know, you don't know. So stay in your home for 14 days. If you didn't become symptomatic, we feel safe that you're okay. Just go ahead and go about your business. Isolation is for those individuals who are presumed to be positive, either due to symptoms and diagnosed by a physician or positive because they've taken a test and they've shown to be positive. Under those circumstances, You're going to follow the guidelines that were laid out by the CDC, and I believe were in Dr. Zarconi's lengthier email release that was substantially longer number of pages than the one you just received. There's additional testing that's going to be in place before you're allowed to come back to work, but you will be managed by our return to work team at that point, which is being managed by Dr. Zarconi and his team.
Could you confirm, after phase 4, the only option for high-risk groups is to go on FMLA?
For right now, that is what we're putting into place. We are going to rapidly assist our team in understanding who in the long run does not have to be here. Who in the long run can spend 1 or 2 days on campus, and we can eliminate offices that way. So if you're an individual who has an office for your full-time work, and we reduce you to 1 day or 2 days a week, we're likely going to eliminate your office and you're going to have a shared touchdown office. This is in the long run. This is a way for us to save money at the university by allowing you to work from home. For right now, the HR team is going to be managing this, and many people are not officially gone on to FMLA at this point. FMLA paperwork will get filled out, and you can do work from, you can stay at home and use leave time. And so under some circumstances, if the medical team thinks it's appropriate and you are listed by your supervisor and their supervisor is being absolutely critical to the operations of the university, they may make an exception in those circumstances. But these are things we're working out right now with the HR team, and I'm answering questions that may get modified or change a little bit over time as I'm trying to give you the best answer I have right now, but we don't have all the answers or all the solutions into place. What we're telling you is we have a safe campus to be on. What we're telling you is end of phase 4, beginning of phase 4, which we've been sharing for the last several months now, begins August 3rd. And what I've been sharing for several months now is that was our target date to be back here on campus for everybody, that we were doing everything within our powers to make sure we had a safe campus for you to return to. If you choose not to return to the campus, it's a decision you're making on your own relative to your own personal situation. And that's going to come with decisions that are both relative to you staying home as well as decisions relative to utilization of your leave or using FMLA. All of us have to make these decisions all the time, whether COVID is present or not. COVID's just one of those things that you're going to make it relative to.
2 final questions. You mentioned a small group of employees being laid off, which is concerning because it can turn into more. Places such as Kent forced salary cuts and upper admin took 10%. Why couldn't something like that take place in order to prevent the layoffs?
Those are decisions that the executive management team will make if we get there. But right now we're focused on individuals who can't be on campus because they can't do their jobs. And under state law, if you are a classified employee and you can't do your job, then you can't get paid. This is I'm being informed by our HR team. This is state law, and it's state law that we've been creative about how to overcome a little bit during the initial days of COVID by allowing you to do things like lean operations training, things that were developing you and bettering you. But as this has drug on a substantial amount of time longer, that's essentially gone away. And so if, for instance, if you're a police officer, and don't get nervous, we need our police officers, they're here, they're on campus. But our police officers have not been taking time off. They have been here and they've been on campus because they can't effectively police this campus from home. No matter what we do, they can't do their job from home.
Last question. Are we lobbying state leadership to pressure Congress to issue new federal funding stimulus dollars to balance budgets and educational funding across Ohio?
All the time. Absolutely, we are all the time. And in fact, the state of Ohio has just distributed $200 million from the federal government. 127 million, approximately 127 million of that went to the major universities, 4 years or more public universities in this state. Neomed did not get a big distribution of that because we don't have a large population of students relative to the others, and we don't have a large dormitory population relative to the others. So we received about 440,000. Actually, I believe it was 460,000, sorry, $446,000. That money can only be used for COVID-19 related expenses. That is it. We're not allowed to use them for anything else. They're very restricted dollars. So we are using that money to ensure we have a safe campus. We will use some of those dollars to ensure we have the clinical team here to help take care of you. We're going to use some of those dollars to ensure that we have proper PPE in place. So the hand gel washing stations. We are using those dollars to ensure we have a safe campus, and that's the reason that money is there. We expect there may be one more allocation, potentially in September, but these dollars have to be utilized before December 31st. Those are the ties that come with the federal funding. But we definitely are lobbying on a constant basis. Mr. Stiliana and his team are in Columbus periodically. In fact, John Stiliana was just there recently, lobbying on our behalf, trying to get the dollars to support us as an organization.
No more further questions.
Thank you. I know these are tough times. We have weathered the storm very well, and now we've set up a safe campus, and our students are coming back onto campus now. It's time for us to lead. It's time to us ensure we deliver a stellar education to our students so that they can become great physicians and pharmacists and healthcare researchers. And this is why we're here. We will do absolutely everything within our power to make sure you are safe here. And as I mentioned before, if we feel for a moment that we don't have a safe campus to be on, we will make those changes. And those changes won't come simply because they're going to have financial ramifications that we're going to have to implement, but we have to put safety first. Thank you.